Well, good afternoon and welcome to the 23rd. And this briefing is brought to you by Marana Group. Marana Group is a data document and distribution solutions company. Marana Group offers a full line of solutions designed to get your company's message into the right hands in a timely and cost-effective manner. And you can learn more about Marana Group at maranagroup.com. I'm Rob Fowler, the CEO of the Small Business Association of Michigan. Brian Calley, president of SBAM, is co-host. Brian, let's start. I actually realize you have a Detroit Tigers shirt on. It's Data Monday, so let's start with this one piece of data. Miguel Cabrera entered a new club, the 500 home run club. Pretty big deal for Detroit and for Cabrera.
Yeah, as we heard, as he hit the a stat that kind of stuck with me as he hit that 500th home run. There's been about 20,000 Major League Baseball players. There are 28 who have hit 500 home runs in their career. So pretty amazing, and I think he's got some more home runs in him too. But I thought we could just kind of mention that might not be totally obvious because this summer has felt more or less normal. Is that those types of events, large scale entertainment events, are now back. They're happening, and that's a really big deal for those businesses that serve the foot traffic for those types of events. So you have conferences and sporting events and concerts and plays and other forms of live entertainment that there is an ecosystem of businesses that serve live entertainment, but also the foot traffic. And most of those are small businesses. And so it's nice to see in an area like downtown Detroit, for example, where you would have that foot traffic return, have the businesses that are doing the lighting and the vending and the sound systems and just all the things that go together for the promotion ahead of time. All of those things, they're really, really important to verticals within the small business community, and so it's great to see them back. So great for Miguel Cabrera, but also for the small businesses that are there to serve the fans and serve the industry.
Yeah, I think we've seen so many times during this pandemic just how interconnected the economy really is, and you can't do something, close down one part of it and not affect other parts. And while I think some thought that was the way it worked, I think we've all got some insight about how interconnected an economy is. Well, we've been saying it's Data Monday. It does give us a chance to check in on what's going on, the trends we've been sort of seeing coming. A potential spike, and I think you're going to give some more insight into where we are in that, maybe what timing might look like, based upon some other areas of the country and of the world.
Yeah, so we're going to take a look at 4 different areas, starting with Michigan, and then we're going to compare and what's happening in Florida right now. We'll take a peek at the nation as a whole, but then looking outside of the country, Great Britain and Israel. So all of those places have, to varying degrees, are dealing with an increase that is driven by this more infectious Delta variant. So looking at Michigan to start with, you can see that it's definitely been slowing in the last couple of weeks in terms of the growth. Now, remember last week we said there are we looked at 2 different possible scenarios. One was that we just have an earlier increase, and that's how it looked. But in the last few releases of data from the state, it really looks like it's flattening. So if we look back here last late summer through July and August, it rose, and then it kind of really slow rise that continued here until October, when it really went up. So here is this a rise bigger than last year, but is this a rise that's going to end up plateauing for a while through September, or will it just continue on up? Really, those are the 2 scenarios. But looking at the percent positive, the positivity during these times, it went up over 7%, but that seems to have leveled off a bit. So then if you look at the hospitalization in Michigan, you see the same thing where it's starting to level off. So a bit of a surprise, because that is certainly not what happened, what has happened in the southern states, which we'll take a look at Florida in just a moment. You definitely see deaths rising, though. While it's much, much less than any of our previous waves, it's still it's still on the rise. So but that's always built in. You know that when you see cases and hospitalizations rise, that even though it's smaller and likely to be smaller because of the vaccines, it's still going to rise some. In Florida, there is some kind of hope, at least, that maybe Florida has hit its peak and is coming back down. But notice that the peak is bigger than it's ever been, and so there's some optimism there that perhaps it's like coming down for real now. So a couple weeks worth of slowing, and then some reports of data of it being lower. Looking at the hospitalizations, it looks like those are slowing down too. So this is a good indication that in Florida, maybe they have hit their peak. So the numbers look like maybe they're starting to come down in terms of caseload. When you see the hospitalization slow down, then because with caseload, you never know how many people are getting tested, and that can affect those numbers. But people will show up at the hospital either way. So the hospital is a pretty good verifier in arrears that if you see an arc or kind of a leveling off at the caseload, you should see it show up in the hospitals within a few weeks. And then, but here's really the tragic part about what's happened in Florida is that the average deaths per day that they are experiencing is actually at the highest point that it's ever been. And now that, and here's something to just as a reminder that this virus is still a killer. The vaccination rates in Florida and Michigan are about the same. So this is something I think that we really need to pay a lot of attention to, that there are there's some differences between Michigan and Florida, but there's also some similarities that I think makes this a cautionary tale for us in the spring, or in the fall. So, but here's something, it's kind of interesting, this graph where an epidemiologist was opining on what might be happening here, where you see Michigan here and Florida there. And now this isn't a surprise to me, because I know the weather patterns and the behavior that people have connected to weather has a lot to do with virus spread. So this, the fact that these two experiences are vastly different make a lot of sense to me. But there was a theory that was shared that I think is worth investigating more and watching. So the theory of this, and I follow a lot of epidemiologists these days. I'm interested to see what they talk about on social media post-COVID. I don't know what epidemiologists normally talk about, because I've never paid so much attention to what they say. But anyway, in this case, the idea was Michigan experienced a unique in the nation wave that was dominated by that Alpha variant in the spring. And so Florida really didn't, not like Michigan did. And so it would stand to reason that our population would actually have some built-in natural immunity that is more recent. So there's all this debate about how long does natural immunity last? Should it replace vaccines? And the policy question on vaccine versus natural immunity, that's one thing, and that's not what I'm talking about. But when you do have a naturally immunity because you've had a previous infection, and that was recent, it does provide some protection against reinfection. And the theory here is that Michigan actually has some natural immunity built into our population, different than other states, because in the spring we're the only ones that went up like this. And so that'll be that's something that I've kind of filed that away in my mind, and I'll watch over the fall and see whether or not we really do look different than other places. One thing I thought worth pointing out here, this Florida looks jagged, is because they only report once a week. So it makes it harder to see trends in the data because of that. The across the U.S., it actually also looks like the U.S. is starting to slow down. And now we know in some places like Florida, for example, that the numbers are starting to slow down. But if you look region by region, so you got the country split up into 4 regions here: West, Midwest, South, and Northeast. They all look like they're starting to slow down in their increases at the same time. So again, another kind of unexpected trend, but it's a new trend, and whether or not it'll continue, or maybe a slow, like we started out with the first couple of slides, maybe in places like the Midwest, when September actually for me is the best weather month of Michigan. It's my favorite month in terms of what weather that we normally have, and so the idea of that kind of ideal weather, and maybe it does flatten things out for us for a while, but really all over the country you see the increases slowing down a bit. So a good sign, even if it's just a temporary reprieve. Hospitalizations around the country, it doesn't show up well in this graph, but they're slowing down as well. There's still some built-in increases, but the increases at smaller percentages, just because of other infection rates. They're still going up, just at slower rates in many places. So hospitalizations nationwide will go up, and deaths overall much lower than before. So even though in Florida they've hit an all-time high, that's certainly not the case in the rest of the country. The United Kingdom, back on the way up though. They've had these false peaks before. I mean, look back here last winter where they went up, they went down, and then they went up a lot. So is this like a false peak, or what's going on here? This is kind of puzzling. Now, the United Kingdom did have this was an alpha wave. Remember that alpha variant that drove that previous United Kingdom wave, just like it did for us in the spring. So, but it was longer ago than ours. So theirs was, really hit its peak in January. And then looking at the deaths in the UK, they have dramatically separated out infections from deaths. Remember from last week, this is because 95% of the population that would normally account for 95% of the deaths from COVID-19 are vaccinated. That type of success, that targeted success, is why you see this dramatic separation. So you look at the caseloads before, and look at the deaths at the same time. And so certainly their success in the more vulnerable populations, people over 50. So we think of 65 and up. Why do we pick 65 and up? It's the Medicare age. There's nothing scientific about it, right? It's what we think of kind of as like retirement age. And but in terms of the way the virus works, 50 is not as at risk as 65, which is not as at risk as 80, but still the risks are pretty significant. And so they've had a lot of success of getting people over age 50. And then looking at Israel, their increases have not started to slow down. They don't have, in the UK went up, down, and now kind of slowly rising. In Israel, it's going up pretty quickly. And then if you look at the deaths, it's not separating as much there as in the UK. Now, what's the difference between Israel and the UK? Well, I mean, the UK was a leader in the country in terms of getting people vaccinated, but not as fast as Israel. So Israel's vaccinations for much of their population, especially the most vulnerable, were longer ago. And so they have really now aggressively started with their with booster shots. And so that's as you look at these different places in the country that are all struggling with, and around the world that are struggling with the Delta variant, the more recent you've had your vaccination, and and maybe if there was a recent infection wave, that there's a perhaps some built-in protection over and above those who went earlier. So you'll see now with a pretty big push happening for boosters. That's what's happening in Israel right now. In the US, that's also going to be a strategy that's employed throughout this fall.
Yeah, I have really appreciated, Brian, the insight that you bring from both the UK and Israel. It's almost like you can see what's coming next for us. And we've been talking about boosters here. The decision by the CDC that boosters will be recommended, I think is really going to be, that's kind of the next chapter in this story for Michigan.
Right.
All right. So we established early on that it is an employer's right. It is legal for an employer to require masks. It's legal for an employer to require vaccinations as a condition of employment if they chose to require it. We're seeing it happen in some places. An interesting article in Cranes, they had done a survey of businesses, mostly small businesses responding, about vaccine mandates in particular. And I thought it was fascinating to see the results. More than half supported vaccine mandates, but less than a fifth of them have actually implemented one. So what do you make of that? It's the people who support it but haven't implemented one.
Yeah, and I'm not terribly surprised by that, because I think there's the philosophy of whether or not you want government involved, and then there's the struggle of implementing on the ground and kind of having to sort out and deal with all the various opinions within the staff on the subject. And so I think what's happening among some are like, look, I'd rather have government take this off my hands and just decide what it's going to be, and then we can just do it. And but I do think that with Cranes, they described it as those that answered were small businesses with mostly businesses under 100 employees. Now, we certainly have members of that size. The vast majority of our members, though, actually have many fewer than 100 employees. So even when you talk about what is a small business, it's different, and I think that if you were to, and maybe we will, I think it's about time, maybe in September, we'll do another survey of our members and test the sentiments out there. But I think you might find something a little different if you asked very small employers. And when I say very small, when you're talking about 10 or fewer employees, and then going up to 25 and 50. I think when you get up to the bigger numbers, like 100 or 200 or 300 employees, you're probably going to get more that say, look, I need standardization. I need, some kind of across the board thing. It's very controversial. If the government just said, here's the rule, everybody's got to follow it, then it kind of makes it easier for them to do that. So that's a theory of mine, that even though Cranes called it small businesses, that they're bigger small businesses. And not necessarily representative, but I am seeing and I am hearing it's anecdotal of the struggles that businesses are having in trying to rectify the very serious and stark conflicts between the opinions of their employees. And not surprising, because we have the divisions of society out there. They show up in our workforces. They're really not any different in that sense. So this is going to be a struggle, and I think that with the decision today by the FDA to give final approval to Pfizer for that vaccine, that these issues are going to come up more and more.
So this debate has manifested in an interesting way in the legislature. There's actually a bill in the legislature to prohibit employer mandates for vaccines, and I totally get. There are certainly businesses who say, "Take this from me." Even the the legal right to employ a vaccine mandate. If I didn't have that, so on one hand, it's if the government would just mandate it, it'd be easier. This would be an easier thing to deal with. On the other hand, some are saying if the government prohibited me from implementing that kind of mandate in my own company, would be another way that you take the mantle from me. The legislature is dealing with this right now as we speak.
They are. So there is a bill. It had a hearing last week that would have ban vaccine mandates in public and private employers, and also the requirement that unvaccinated people wear masks in those same businesses. So this really for SBM falls under the human resources policy that we don't like government dictating. But there certainly are issues that are arising among businesses that they work in a supply chain somewhere. They work on, they're a contractor that work on in somebody else's business. And it's one thing to say I've got a policy for mandating vaccines. It's another thing though to collect information, to verify it, and then it's another thing to share that information with a third party. So these are three kind of escalating issues that small business owners are facing. And I think with the final approval coming with Pfizer, the idea of additional mandates going into place, there'll be more that go into place in the future. So there's a question, do you mandate it for your workforce? Okay, that's one question. The next question is, do you verify it? Do you require the employee to give you documentation showing or proving that? And then number three, do you share that information with a third party who requires to know for doing business with them? These are really they're difficult decisions for a small business owner to make, but they're also kind of groundbreaking in terms of practices and protections and privacy. And this is different. I've heard people say, well, you gotta the vaccine records at the public health department are shared with the school. There have been decisions that have been made over time for record sharing, but they're between entities that are governmental entities, but also highly regulated. There's systems for it, and not anybody can get at those records. There's a system already built for it. In this case, there's not really a system built for it. I've seen the Clear system, which is used at like airports and things, that some businesses are borrowing. That has been modified to be used for some of these purposes. But then that's now another party that has the information that is being shared among others. So like the legal and moral implications of this are really hitting some businesses, some sooner than later. Some of them might have to deal with this right now. I've got a vendor I'm a vendor for a company that's requiring this. What do I do? And I think it really makes sense for our members to start thinking ahead of, what would I do if this was required of me? Would I walk away from the business? Should I start talking with my employees now? Should I get a sense? Do they have a problem with certifying or promising or whatever? Share, in some cases, maybe using a system like Clear to share the information to move forward. These are questions that people are increasingly likely to face in the future, and it makes sense to start thinking about it now.
There's another place that this is playing out kind of right before our eyes, and it's the 15 public universities in Michigan who are not only dealing with, what do we do with our employees, but some have taken the additional step now of requiring students to be vaccinated. And it's interesting that it's a pretty low percentage of students who were vaccinated before at least this mandate came along. But not all the public universities are doing it. In fact, the majority are not a full vaccine mandate for all students returning this fall. Some are not, and some are not going to, and some were early adopters. What can we draw from that?
this is the same. It's the same thing that we see playing out in companies. You see the bigger ones that are saying, you know what, we need across the board standardized type system and just applying it to everybody. And in the smaller ones that are tending to take a different approach. Now, I do think that that the FDA move to approve at least Pfizer with the full approval today is probably going to move some additional universities. It will also trigger mandates that have already been put into place over Grand Valley and also Spectrum, the hospital, the health system. Both of them said there's a certain number of weeks after that approval comes, then you got a certain number of weeks as a condition of employment to get vaccinated, or in the case of a student, condition of matriculation to the university. And that is that's going to be an issue that I think changes quite a bit over the next month or so. The age group that students are in, a little less than a third of them are vaccinated on average. So whether or not the ones going to college have higher rates than the general population, I guess that's yet to be seen. But I'm very confident saying most are not, and so this really puts the students in a position of making that decision. Am I going to pursue the education and get the vaccine, or do something else, or take a semester off, or whatever? I mean, in real time, this is groundbreaking stuff. You know, what is human behavior going to look like when a new factor like this is inserted into it? We really don't know. I do think that the schools like U of M will have an easier time with mandating than other schools will. Just the exclusive nature of it, and people, dreaming their whole lives and getting in, and so the idea of most students just doing it there, I think, is pretty likely. In other places, it may or may not turn out that way. But it's something that I think will be very interesting to follow. Does it affect enrollment? I think is the big question.
Yep, absolutely. I think that's the hospitals are having the same. Some hospitals have required it as a condition of employment. Others have not and will not. And it is very interesting to see if the ones who are not are going to be the beneficiary of nurses and other staff who leave their current employment. And so it may shift employees, it may shift students. There is a market reaction to all of this, and we'll watch what it does. So one of the other things we've been doing is just kind of watching what is the state doing, because what the state does will give a good indication of what they may be requiring for others. Last week, late in the week, the Michigan Department of Health and Human Services announced some additional, for their own employees, some additional requirements and their own workplace.
Yeah, so you have a couple of things happening. The state does have visitors. So in like Department of Health and Human Services offices, people can come in. Secretary of State offices, people can come in. But then there's the workforce itself. So the state's moving back now to indoor universal masking, and that would go for visitors and employees. They have not moved toward vaccine mandate. I haven't seen any indication of that at all. In fact, quite the opposite. So the state as an employer, I've got some experience obviously dealing with, the process that you go through in terms of new rules for state employees. And it's not, I don't think it's very feasible that something like a vaccine mandate would be imposed in the civil service system. I just don't. It's possible, but I don't think it's very feasible. But something like a mask requirement, especially since there had already been one previously, is I think was not a complicated thing to re-administer or re-implement. So, what does that mean for employers? the idea that that the state would try to impose some sort of a mandate policy on vaccines, I think is off the table as it can be. You know, nothing's impossible, but I think it's about as off the table as it can be. And then when it comes to things like, you know, workplace safety rules or masks and PPE and different those types of requirements, I think it's possible that something like that comes back. It's not in the works right now that I can tell, but there's the amount of there's already a bunch of pressure building in the system. If you look at the questions that are asked of the governor in press conferences, that it's just getting pelted with, why aren't you doing masks? Why aren't you doing masks? You know, look what's happening here, and why don't you, you know, and it's focused mainly on schools, but that, you know, people are going to go back to school, and then there's, you know, that however that turns out, it's going to, you know, that issue is going to be an older issue. And then I think facing a fall wave is when the pressure really mounts up and the risks mount up of there being additional workplace safety requirements that are imposed as opposed to recommended as they are today.
Yeah. Hey, let's end with a new study by some researchers from Cold Spring Harbor Laboratory and Yale University, really about the efficacy of vaccines to the Delta variant. And I think that everybody's concerned that maybe that there are going to be way more breakthrough as a result of you know, just this new variant. What can we learn from this research?
Yeah, so I do. I'm not an epidemiologist, but I appreciate the following many of them and just, you know, getting their take on new research just constantly coming out. And this new piece was actually quite favorable toward the infectiousness of those with breakthrough cases. So we saw that the CDC was relying previously on a study that showed that, hey, the viral load of a person who was vaccinated and had a breakthrough case was the same as the viral load of somebody who was unvaccinated and got COVID. And but it was a small sample size and a lot of caveats with that study. So with this new one, that basically I just pull out the very end, the conclusion, a quote here. We conclude that rare vaccine breakthrough infections occur, but infectious virus shedding is reduced in these cases. So just another little piece to it that was different than something that we pointed, a different study that we pointed to last week. And so what'll happen is that'll get peer reviewed. The other one will get peer reviewed. There'll be a bunch of other studies that come out. And then, you know, say a month from now or 6 weeks or 2 weeks from or 2 months from now, there'll be more of a consensus that will develop on, okay, on a breakthrough case, are you as infectious or not? In this case, we have one that says, yep, you are, and another one that says, no, actually, you're not. It's reduced, and so I'll keep. You don't need to scour the internet for the studies. I'll keep an eye on those two, so you can get, because this has a big impact on whether or not universal masking of employees is a policy that's more likely to become more widespread.
All right. Well, I appreciate the fact that you're following the epidemiologist. I think at the beginning of this thing, I don't know that I could pronounce that word, and so good. And you know, most importantly, synthesizing it for what it means to small business. That's